Todd's Carpet and Tile Cleaning. Call or text 702-595-0488.
In Nevada, there's still a law on the books that says if you are living with HIV, you have to disclose your HIV status to your sexual partners. But if you don't, there's still possibilities of some prosecution where you could actually spend some time in jail if you don't. We're working very hard to get this U equals U, strategy kind of moved up in the legislative system so that we can take away this barrier for patients living with HIV and kind of reduce some of the stigma for the people living with HIV. And JP is going to talk a little bit about a strategy for U equals U that's going on through Clark County and Nye County about how to stay healthy and how to keep yourself undetectable and how to not transmit the virus.
Hi there, my name is JP, and I am an HIV positive individual, and I am undetectable. And being undetectable actually means that I cannot transmit my virus. I'm untransmittable even if I tried. It means that the virus is so low that it cannot be passed on via sex. If you or a loved one is dealing with HIV or would like to know more information about HIV, you can totally visit our website, u=uloss.com. They will give you more information on where you can find HIV resources, HIV information, and also prevention resources as well.
For context, the U equals U campaign is undetectable equals untransmittable. And this is based on a lot of scientific data from several studies. One is the partner study, one is opposites attract. And basically they looked at couples who are in serodiscordant relationships. So one partner's positive, one partner's negative, and the positive partners were not responsible for any new infections in their HIV negative partners. And this was in the men who have sex with men community, men having sex with women communities as well. And there were several hundred patients that they looked at over many different acts of sexual encounters. Then there were no linked infections. There were several people who did become positive in the study, but when they did the genetic tracking for those infections came from partners that were outside of that relationship who had a measurable viral load or who were viremic, and that's where the transmission came in. But that's our strategy for me staying HIV negative is U equals U. So JP stays on his medication, which is a strategy called treatment as prevention or TASP. So he takes his single tablet every day, Biktarvy, that keeps his virus under control. So this is a great way for people that are at risk for HIV, but also people living with HIV to maintain that negative status and to actually keep themselves healthy and well so that, they're going to live 50, 60 years like everybody else. HIV is not the disease that kills people like it used to back in the early 80s. It is a very manageable, very chronic disease. And from my perspective as a treating person, as a provider, it's easier for me to take care of somebody living with HIV because of all the stigma that's associated with the disease, and people want to stay in care. They want their virus to be under control. They don't want people to know they're living with HIV. Versus somebody who's diabetic, me, I'm like, everybody needs to know about my diabetes. Like, oh, you're diabetic. Well, you shouldn't have that sugar or whatever. So from my perspective as a treating provider, it's actually easier to take care of somebody living with HIV than many of the other chronic conditions that we see.